All right, so now we're going to talk a little bit about the different stages of your labor. The anatomy is really important when it comes to understanding what labor entails. You've obviously got your uterus, but there are different sections of your uterus. At the top, we've got what's called the fundus, and this is the big, thick part of the uterus. And this is also the part that contracts and kind of pulls the cervix up out of the way during labor. And this is what opens up, and we often talk about dilation, how far along they are in labor, or that's what the medical model does anyways. And then we've also got the pelvis, which baby rotates in and out of. You've got your oxytocin, which is the love hormone. And this is actually what contracts the uterus. When baby's in a good position as well, low and even on the cervix, that will trigger a positive feedback loop, which tells your brain release more oxytocin, which contracts your uterus down, presses baby on your cervix further, and then it kind of continues that positive feedback loop until your baby is born. There's endorphins, which your body releases in response to pain and stress, and those are kind of your natural pain relief hormones, basically. Adrenaline, which is released in stressful situations, can inhibit your endorphins and your oxytocin release. So we're wanting a nice, calm, positive environment. Another good way to think about it is making love, which is an act that you do that releases a lot of oxytocin. That's easiest in a private space for most people. Then when we're looking at the normal kind of timeline of labor, obviously every person is going to be different. In the medical model, we have what's called normal progress. This is based off a study done in the 1950s by a doctor called Dr. Friedman. And in this study, there was a specific cohort of women. Their labors were tampered with, drugs to speed the labor up and other drugs to calm them down, and it was all very tampered with. And he found that women should dilate at 1 centimeter an hour if it's a subsequent baby, and 0.5 centimeter an hour if it's their first baby. And so now we've got this graph, which is a little bit bonkers really, because obviously every person is different, but that's what this is based off. So we have stage 1, stage 2, and stage 3 of the labor. These stages aren't necessarily reflective of women's experience, but just the medical model's expectations when it comes to labor and birth. Stage 1 is the process of your cervix being 0 centimeters dilated, so your cervix being shut, so your cervix being completely open. And stage 2 is from when you commence pushing your baby out until the baby being born. Stage 3 is from the baby being born until the birth of the placenta and the bleeding being under control, so to speak. Stage 1, it's the longest stage of labor. So for some people, this can take days, but generally speaking, stage 1 is broken up into your latent phase of labor or your early phase and your active phase of labor. And at the end there, we have what's called transition, which we'll talk a little bit about soon. So in early labor, this is usually the longest. So it's when your contractions or your surges are really irregular. Some might be 10 seconds, some might be 30 seconds, some might be a minute, and then it might go back to 10 seconds. You're generally able to speak and think pretty clearly and go about your household chores, maybe prepare your other children's lunch or whatever, set up the birth space. This generally means things are still early and your cervix is just starting to thin out and open a little bit. Some of them might be painful or quite painful. It's about just keeping that space as relaxed as possible. Try to reduce the amount of adrenaline and cortisol in your space and just let things be as much as possible. Of course, call your midwife or your health provider if you have any concerns, but the research does show that those who stay at home as long as possible and have minimal intervention when they're healthy and well, they are more likely to have straightforward births with minimal intervention. It's not uncommon to have a little bit of bloody show at this point, which is like a mucousy discharge with streaks of blood. You might just have irregular contractions. Some people find that they poo quite a bit in this early stage, and then it's kind of like a clear out because your uterus is a little bit, I guess, irritated and irritating your bowel as well. Basically, it's really important to focus on rest because it could be a while. Keeping your space really calm to encourage those hormones to continue labor. Use gentle pain relief methods like a TENS machine or some water, a shower, potentially some Panadol. Drink heaps of water, eat food as normal, nourish your body, and just let things happen as they should. Eventually, you'll progress into the active phase of labour, which is the point where it's recommended you have your midwife or your health provider assessing your labour. So that involves listening to baby more regularly and just checking that everything appears to be normal, because midwives and LMCs can assess things that maybe the untrained eye wouldn't see. This looks like contractions coming hard and fast and being really inward. So the birthing person's probably not responding to outside stimulus as much, and they're really inward and focused. The contractions are, generally speaking, every 2 to 3 minutes. So we often have this 3-1-1 rule, which is 3 contractions in the space of 10 minutes. They're lasting about 1 minute long at least, and it's been doing that for about an hour. So making sure it is consistently happening and you're not calling someone too early. This isn't just about calling a health provider too early and making them work too long. It's also about protecting the birthing person, because having someone in their space too early, it can introduce unnecessary stress and raise cortisol levels and raise adrenaline levels and inhibit the normal process of labour. The birthing person will be working quite hard until they're ready to push. Often when someone's approaching 8 to 10 centimetres dilation, they do have a natural surge of adrenaline, which gives them energy to push their baby out, but it can also look a little bit like fear in that moment. Some women might cry or ask for interventions or want the baby out now or feel doubt or fear, and that's really, really normal. That's a balancing act at that point between providing the person reassurance but also listening to them. After that, you've started your second stage of labour, which is pushing the baby down and out. So this can take anywhere from, for some people it's really quickly, but for first time mothers we allow up to 2 hours is considered what's normal. You'll feel like you need to poo at this point, and some people won't believe that it's baby. Your baby is going to be pressing on that bowel as they come out, so it's really normal. Your health provider will recommend listening to your baby's heart rate a bit more frequently at this point. Baby is kind of coming round a corner, so to speak, and it's really clever because they want to stretch your tissues slowly and not kind of burst through and tear them. So it's really normal for babies to advance a little bit and come back, advance a little bit, come back. It will feel like a burning, stretching sensation when this happens, but it's really, really normal. Some people like hot cloths on the perineum. Some people like to use the water, so birth in the pool, which is considered really safe in low risk people. It's also really helpful to still have a TENS machine on in some situations, not in the birth pool, and this helps kind of distract you a little bit from the pain. So when it gets to the point of baby crowning, which is when baby stops rocking back and forth and they're only inching forward, your midwife or health professional will generally talk you through the birth of the head, or at least to make you aware to stop pushing and to breathe a little bit. Sometimes that will look like going or to kind of slow down that really intense push reflex, because baby wants to come at that point, and we do want to give your tissues time to stretch around baby's head. It is going to be quite overwhelming at that point. It's a really intense, stretchy feeling, but it's not for everybody. It isn't this ring of fire. Everybody explains your tissues often feel quite numb at this point, and it just feels quite intense. When baby's head is born, sometimes we can wait a contraction for baby to then turn and then the shoulders to be birthed, but some babies just come straight out. In most cases, if you're happy with this, baby will be placed on your chest for skin to skin, as this is really, really good for the mother and baby bond. The cord is still pulsing at this point, and this is now when we begin stage 3 of your labor, which is waiting for the placenta to be born and the main lochia or blood and fluid to come out afterwards. So the third stage of labor generally takes about an hour for most people. You might feel quite crampy, you might have a little gush of blood either in the pool or on the bed or wherever you are. And that shows that the placenta is detaching and it's ready to be born. Your uterus does quite a good job at contracting down to bring the placenta out, and in some situations your healthcare provider might offer a synthetic shot of oxytocin into your leg, which will aid in birthing the placenta if there are any concerns about excessive bleeding. After the placenta is born, you might have a bit more bleeding. If there's too much, then they might talk about further drugs to offer you. And again, that's just contracting the uterus down. If you imagine a cut on your body, just clamping it down is really important to stop that bleeding. After birth, we have the golden hour, which is considered the time we don't want to mess with anything. So most people will be left alone to bond with their baby, to try breastfeeding, to just really have that moment with their baby and their whānau or whoever is around them in that moment, because those undisturbed moments are really crucial with mother-baby bonding and breastfeeding optimization. So tell your healthcare provider what you want in those moments. Some people want photos, that no hands on them at that point. They want delayed cord clamping. Some people might even want something called a lotus birth, which is keeping the placenta completely attached to baby, and that's more of a spiritual thing. There are lots of things you can add into your birth plan to make this experience seem a little bit more like a normal life event rather than a medical one. It's just about figuring out what's right for you, but also knowing what the recommendations are in labour. Your midwife and healthcare provider will talk more specifically around timing of listening to baby in labour, examinations, screening tests, all the different interventions, and really about knowing kind of the normal process of labor and how you can optimize your hormonal state. So, because that is often what leads to less interventions and a more satisfactory birth experience.